Good afternoon. My name is Miriam Chaudhry, and my partner Alice Chavez are the executive directors of a public health national nonprofit known as Mason Pro Health. And we are here to present to you, the Congress, our plan of the next 5 years to better help prevent and be more prepared for future pandemics such as COVID-19. As we all know, we are currently experiencing a pandemic known as COVID-19, the coronavirus pandemic. The coronavirus is affecting 216 countries and territories around the world today, and it has unfortunately taken the lives of over 1 million individuals globally. In the United States alone, it has caused over 10 million cases of patients who have been affected by this, and it has caused over 240,000 deaths, and that number is just continuing to increase every single day. It is our job as a directors to collaborate with you, the Congress, to ensure that the nation is better prepared for future pandemics. The first thing that we would like to address is the supplies. When the coronavirus first hit the United States and cases started sporadically increasing, there was a major decline in the number of supplies that were available. Medical personnel, nurses, physicians, they were all asked to wear their personal protective equipment multiple times for days on end, the same uniform over and over again because there was a shortage of the supplies. So to ensure that the strategic national stockpile has essential supplies, drugs, medical devices such as ventilators, which were also on a very low supply, and personal protective equipment for all the medical personnel needs to be readily available. Also, Greg Burrell, who was recently retired as the director, told CBS News that the stockpile has been used up for the most part, and the machines, such as the ventilators, have not been restocked yet. In case that there is a future pandemic, that's the first thing that we're going to need. We're going to need ventilators, we're going to need protective gear for all of the medical personnel who are putting their lives on the line for patients. Though Congress has provided funding to increase the stockpile, Burrell stated that it's going to be hard to prepare for a second wave for a future need if we can't even sustain, future investment. So that is definitely something that we want to pay specific attention to. The second thing that we want to mention is increasing medical personnel. In terms of preparing for predicted long-term medical shortages in healthcare workplace, we're going to need more doctors to care for our growing and aging population. Physicians, including primary care physicians, specialists in critical care, infectious diseases, psychiatrists, as well as hospitalists. It's evident that we're going to need to increase our personnel. So in times like this, where there's going to be an influx of patients who need medical services, there is not going to be a decrease in personnel. There should only be an increase. While the number of doctors enrolling in U.S. medical schools has increased by 30% over the past 15 years, the government should increase its support of graduate residency training to overall increase the number of practicing physicians. As I mentioned, especially in times of a pandemic where we're going to need all kinds of medical personnel to ensure that the patients are being cared for and the patients are being looked after in critical care situations.
Thank you, Miriam. So now I will be ending the plan on how we plan on coping with future pandemics. We need all levels of personnel to step up from lower positions all the way to higher positions. We need dispersing of healthcare individuals to be more effective. Allowing non-physicians like experienced nurse practitioners and physician assistants to perform a wider range of basic medical procedures and prescribe certain treatments without direct supervision by a doctor. This will allow them to be able to go on their own and not take up time from two providers. We need to also allow improvement in access to care in rural areas in various states. Physicians will be focused on providing other medical services, so there can be more individuals who are managing and diagnosing patients with COVID-19 and other pandemics that do come up. Lastly, medical research. We need to increase long-term federal investment into medical research. The more you know about a virus, the better it is to be able to find a solution. Over the past few years, Congress has strengthened the nation's commitment by increasing funding for the National Institutes of Health. And the legislation just passed includes additional funding for vaccine development. But there's still a long way to go to build our defenses against this virus. The Centers for Disease Control and Prevention are in dire need of increasing appropriations. Funding for our great research institutes like the National Institute of Health and the National Science Foundation must be a top priority because they do provide the resources on increasing medical research. Researchers like clinicians are at the front lines of this fight, and we can never let our guard down again, because we've seen as a result what can happen to our nation. In conclusion, even though we are still working to find a permanent cure for COVID-19 in this current pandemic, our number one priority is to create this plan for the next 5 years to cope with this current pandemic. So then we are better prepared in the future. We are asking Congress to work with us to use supplies, increasing personnel, getting additional help from all levels of staff, and continue to do medical research to cope with any future pandemics. Thank you for your time.